One possible cause for vaginal bleeding after 20 weeks of pregnancy is a placental abruption. And this happens when the placenta prematurely detaches from the uterine wall. And it can be mild and perhaps managed with bedrest to prolong the pregnancy and try to get some more time out of it. Sometimes it's severe enough that the woman's losing enough blood or the baby isn't getting enough blood and it poses a threat to the pregnancy and immediate delivery is necessary. So the bottom line is, if you experience vaginal bleeding during pregnancy, get checked out. This is one possible cause for it that a doctor will consider. So at the end of the day, it all comes down to how the mother's doing and how the baby's doing, and that determines if intervention is warranted at that point in time. A lot of the time, abruptions are just random. Sometimes they just happen and there's no logical explanation, but there are some risk factors that make an abruption more likely. Some examples include substance abuse, abdominal trauma, elevated blood pressure like preeclampsia and pregnancy. If the mom has certain blood clotting disorders, that puts her at higher risk for having one. If you have twins or triplets, basically if you're pregnant with more than one baby, that puts you at higher risk. And maternal age also plays a factor. And so as you can see, sometimes it's circumstantial, and in other cases, it's just something that happened randomly and it's not likely to happen again. Now, if you've had a history of an abruption, then your chances are slightly higher of having one in future pregnancies, but it's not an absolute. In other words, if you had one in the past, you don't have to assume that it will happen again. The chance of recurrence is about 10%. So if you've had one in the past and you're concerned about getting pregnant again, talk with your OB provider before getting pregnant, and they can talk with you about what risks might actually apply to you and determine if intervention is warranted before conceiving in order to reduce your chance of risk. For example, if you have chronic hypertension, that's something that might be able to be controlled and managed before you get pregnant again, so that you have the best chance possible at being healthy and having a healthy baby. If you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.